So today there are 60 new COVID cases in the community to report. 56 of those are in Auckland and 4 are in the Waikato. Our total number of cases in this outbreak is now 2,158, and pleasingly 1,389 of those have recovered. It is a drop, obviously, from yesterday's 94, but we do expect the numbers to bounce around, and as we've said before, the overall trajectory is that they will keep rising. 22 of today's cases are yet to be linked to a current case, but interviews are well underway, and of yesterday's 94 cases, 34 still remain unlinked at this point, but again, interviews are proceeding with those cases from yesterday. Today there are 43 people in hospital, 5 are in ICU or high dependency units, and all are in Auckland except for one person who is in hospital in the Waikato. Of the 4 new cases today in Waikato, 2 of those are close household contacts who were already in a quarantine facility, and the other 2 are known to have likely links to existing cases. So the total number of cases in Waikato to date is 56, 10 of those have now recovered. Testing continues across the Waikato, and I'd ask anybody with any symptoms in the Waikato to please go and get tested, particularly anyone in the Te Awamutu area. And or if you know you may have been in contact with one of the people who is now a case, please go and get tested whether you have symptoms or not. Now, yesterday Newlands Shadbolt Park was classified as a location of interest. It's now been reclassified as an exposure event and been taken down from the Ministry of Health website. Having looked further into the event, which was being managed by a PHU elsewhere in the country, it's now been assessed as being an exposure event with a small number of people who are contacts. They are all known and have all been contacted and are all isolating. No one else has been sought in relation to the event. Testing in Auckland, the team up there has moved away from using suburbs of interest because the infections are now quite widespread across Auckland. Testing is going to be focused on those areas where they are finding a higher test positivity rate, where the risk of unidentified cases is potentially higher. So in that vein, people with symptoms, even if they are mild symptoms and even if you have been vaccinated, in Newlyn and in the North Shore suburbs of Rosedale, Redvale and Bayswater, please do go and get tested as soon as possible, and of course isolate until you get your result. From Thursday this week, healthcare workers in our managed isolation and quarantine facilities will be allowed to work in other healthcare facilities without the need for a 48-hour stand down and negative test requirement. This will allow greater flexibility of using that MIQ workforce and of others being able to supplement that workforce and reduce some of the pressure, the real pressure that is on that workforce. It's particularly important in Auckland and Waikato as they move to supporting community cases to isolate at home. Just a quick clarification around the third dose for immunocompromised people, and again just reiterating this is a third dose in the primary course for people who are immunocompromised. This is a third dose of the Pfizer vaccine for those 12 and over for a small group of people. There is further detail going up on the Ministry's website this afternoon about what the inclusion criteria are and about how those people will be both identified and then receive their third vaccination. And that will not be through using the Book My Vaccine approach. So you will not be able to book a third vaccine on the Book My Vaccine website, and the detail about who is included and how that process will roll out will be on the Ministry website later this afternoon.
Covid-19 significantly disrupted many of our lives, and I'm acutely aware of the impact restrictions have had on our learners in our education system. Exams are racing up for our senior secondary school students in particular, and the stresses and strains that learning from home creates become more evident by the day. The decision on schools and early learning services in Alert Level 3 areas is a really finely balanced one. We want to get our young people back into the classroom as soon as we can, but we also want to keep them and the wider community safe. We've been consulting with education and sector leaders, and based on the latest public health advice, have determined that students in years 11, 12 and 13 will be able to return to the classroom in an Alert Level 3 area from Tuesday the 26th of October, i.e. after Labour weekend. That'll allow those students back to school so that they can prepare for their end-of-year exams and complete their NCEA assessments. Learners in the age group are able to be vaccinated in that age group and will require them to wear masks whilst they're at school. Staff and volunteers working on site will need to have a negative COVID-19 test before returning. Children, young people and staff at higher risk of severe illness from COVID-19 should stay home unless they are fully vaccinated. Records will be required to be kept for contact tracing purposes. Face coverings on school transport will be mandatory, and staff and volunteers at schools in all regions will need to receive their first vaccination by no later than the 15th of November. I'm also confirming today that NCEA and scholarship exams will proceed, including in Alert Level 3 areas. With Auckland, Waikato and Northland experiencing further COVID-19 disruption during Term 4, the New Zealand Qualifications Authority has confirmed that these students will be eligible for an unexpected event grade that recognises the work they've done. While students will still be expected to attend exams where possible, the long-established unexpected event grade process will reflect what happens in any year where a student's attendance or performance in exams is affected by illness or injury. This grade is worked out based on their schoolwork throughout the year. So students in Auckland, Waikato and Northland who can't attend an exam because of a COVID-19 specific disruption will receive their unexpected event grade. Where they do attend the exam, they'll receive the better of their exam grade or their unexpected event grade. NZQA will be working with schools to put public health measures in place to protect staff and students in the exam rooms. Those familiar with exams will know that social distancing is an integral part of the examination process and a normal part of exam conditions. While classroom teaching and learning was disrupted by COVID-19, students have continued to work hard and they deserve the opportunity to safely demonstrate what they've learned. So today's decision provides certainty to our senior secondary school students, while recognising that those who are not able to perform at their best will have their specific circumstances recognised. For years 1 to 10, the picture is a more difficult one. I'm not completely ruling out these students in Level 3 regions being able to return before the end of the school year, but if they do, we'll need to be satisfied that there are sufficient processes in place to be able to minimise any risk. We have to acknowledge that any settings where there are groups of children under the age of 12 create higher risk. These are people who are not able to be vaccinated at the moment. But there are some mitigations that can be put in place to help keep risks as low as possible. So we can consider things like rostered attendance to reduce numbers on site at any given time. In the warmer summer months, education outside the classroom in an outdoor environment where it is more difficult for COVID-19 to spread is also more possible. So Cabinet will consider the latest health advice and further decisions on schooling, particularly focused on years 1 to 10 and early childhood, next Tuesday. Coming to managed isolation and quarantine. The changing nature of our COVID-19 response as we enter a phase where we've got a more highly vaccinated community and when we're dealing with locally acquired cases in the community does prompt changes to our border settings. We're considering shortened MIQ stays and greater use of self-isolation for those coming into New Zealand, and I hope to be in a position to make more announcements on that in the coming days. In the meantime, we are making some changes to address specific challenges that some groups are facing. From the end of November, there will be an ongoing allocation of 300 rooms per month in our MIQ facilities set aside for critical health workers. We have created an allocation for ministerial travel, for trade negotiations and international relations. And decisions have been made about the November and December time-sensitive travel allocations. These are predominantly going to the health sector, agricultural sector, engineers and technicians, military and diplomatic personnel, and 284 rooms have been allocated to 350 people across those groups. That'll help us to see skilled workers from a range of sectors entering into the country to carry out work that will have significant benefits to New Zealand. I acknowledge that there's heavy demand for MIQ spaces at the moment, especially as we head towards Christmas. We do need to strike the balance between reconnecting with the world, bringing people home, looking after our local community cases, and of course looking ahead. I think we can all be very proud of what we achieved over the weekend. We need to keep that momentum going. Today we're launching a new campaign called 2 Shots for Summer. It predominantly targets the 16 to 29-year-old age cohort, the group that we have to get a better vaccination rate within if we get to get our rates really high, encouraging them to get fully vaccinated by December.